Every year, about 3.8 million new cases of cataract-related blindness are reported in India. That's more than the entire population of some countries. And yet, despite this staggering number, millions remain undiagnosed, living in the shadows of their blurry world.
I'm Dr. Advaith Sai Alampur, and today we are tackling a severe cataract case. When untreated, cataracts can turn into a complete blockage of vision, affecting the simplest tasks. But surgery can bring back what's lost, the gift of sight. Let's see how we do this. So what happens when you delay your cataracts? I'm Dr. Advaith Sai Alampur, Cornea, Cataract and LASIK Surgeon at ENVISION LASIK Center, Hyderabad. So we've just completed operating on a patient who was having a white cataract. This is a total cataract. Basically, this is a cataract when you delay your cataracts. So what happens is, in a cataract surgery, we have to remove the cataract and place another lens. Now this cataract, normally what happens is, in such cataracts, there is a very high chance that complications can happen. Because in a cataract surgery, we remove the cataract and keep the lens in the bag. So the bag has to be stable. But sometimes in such cataracts, the bag can be a little weak.
A cataract is the clouding of the natural lens of the eye, which leads to blurred vision, faded colors, glare, and difficulty seeing clearly. It occurs when proteins in the lens clump together and block light from passing through. The most common cause is aging, but other factors include genetics, diabetes, eye injuries, prolonged use of steroids, smoking, alcohol, and excessive exposure to UV rays. In some cases, babies may be born with congenital cataracts. While cataracts develop gradually, they can significantly affect daily life, but vision can be restored through a simple and effective surgery.
Now this patient, the surgery went on extremely well. This is a total cataract or a white cataract, as you can see here. So in this patient, opted for a toric lens. Basically, toric lens means that the patient does not want to use any glasses for the distance vision. So toric lens, basically what we do is, we keep a lens in such a way that the lens is aligned with the axis. As you can see the blue lines over here, this is the completely Zeiss Callisto system, which is a completely digital system. There is no manual marking here. This basically lines helps us rotate and position lens exactly in the bag. Now there's no chance of any human error, and such patients are seeing very clearly from the very next day. Now this patient, the vision before the surgery, he could not see anything beyond this distance. And now post surgery, by tomorrow he'll actually be able to see clearly, and not only see clearly, because of the advantage of this toric lens is that he'll be able to see without any glasses. So that is the biggest advantage of toric lens. Now not everyone is suitable for toric lens. Only those who require the toric lens, only for them we ask them to go for the toric lens. So this is all about cataract surgery. Now what you need to understand is, cataract should not be delayed. If it comes to this stage, it is not always going to be pleasant to the patient. That is the reason why when your cataract is diagnosed, it is always better to get it treated at the earliest stages. Early stages, normally cataract stages are stage 1, 2, 3 and 4. Stage 1 is mild and stage 4 is severe. So ideally, it is always better to get it done at stage 1, 2 or 3. So in case you want to know more about cataract surgery or any doubts, you can just post your questions in the comment section. We'll be answering all your doubts.